rahmatullahi wa barakatuh. With you, Dr. Wasfi Dhahir from College of Nursing, University of Basra. And today we want to speak about the drug level in plasma and the therapeutic responses of this drug. First, why we need to measure plasma drug levels. That is because it's very important to maintain a plasma level between the minimum effects concentration and the toxic concentration of this drug. And also we must know something about therapeutic range or concentration, and this is very important to also maintain enough drug present to produce therapeutic effect. Our goal from the measuring of plasma drug level, because that plasma drug levels is very important to maintain or to determine the therapeutic range. So the minimum effect concentration of the drug, we can define it as plasma drug level below which therapeutic effect will not occur. And also we can define toxic concentration of a drug, that is the plasma drug level at which toxic effect began. So this is the difference between the minimum effect concentration and the toxic concentration of the drug. In this diagram, which is show the relation between the dose, that means the plasma drug concentration, and the time duration. So we have the three levels. The first one, this is the dark, so light blue. This is maintain the minimum effect concentration here in this point, and then it rises to give a therapeutic effect, and this is the therapeutic range, and then it return back to its minimum effect concentration. Over this white area, this is light blue area, when the blood reach this area, so the plasma level reach the toxic concentration of the drug. The therapeutic index and drug safety. Here we must know that each blood have a safety margin or safety border. This is what we call the therapeutic index, which we can define it as a value representing a drug safety or drug margin of safety. So the therapeutic index shows the relation between therapeutic effect of drug and its adverse effect, and also determined by the degree between the therapeutic dose and toxic dose. So the margin of the safety, that means the serum drug concentration within the therapeutic range. This is the drug in safety plasma level. So the drug with high or large TI are safety drug, while the drug with low therapeutic index are dangerous or potentially dangerous. Now, why we measure the serum level of a drug or serum drug level? This is very important for in several circumstances. First, when a drug with low or narrow margin of safety, this drug, the margin of danger and the safety is very narrow, like tetrodotoxin, that is the drugs for the heart, or lithium. These drugs have a very narrow margin safety and are very dangerous, or we must take it under monitoring. And the second one, to monitor unexpected response to the drug. So the safety margin or the therapeutic index can help us to expect the unvariable dose, and this could be either lack of therapeutic effect or increase adverse effect. The third one, that measuring serum drug level we can suspect from it the overdose, which may be toxic. This term, drug half-time, this is the period of time needed for the medication to be reduced by 50% in the body, that it lose 30% of its concentration in the plasma. And this diagram shows the relation between concentration and the time half, or the 50% of drug in the body. And you see in this is red star, the half time of the drug, which is here in the concentration, and there is a time, and this is 50% of the drug will lose from the body. So the short half time requires more frequent administration, and the drug has a long half time. A long time can separate dose. So here we have other term, which is we call the plateau or the steady state. When we give a repeat doses, the drug will continue to accumulate until the amount of the drug eliminated between doses equal to the amount of the administered. That means the relation between the dose elimination and the dose that administered. And here you see in this diagram also the relation between serum drug level and the time by days. And you see here, if we give a repeated dose, when we reach the drug or the minimum effective therapeutic dose, this is here the starting of the effect, and then it become regularly, and then here it is state or steady state, becoming a steady state. We call it plateau, and then it remain. It also decrease also by interrupted or irregular drug level, and then it reach the minimum effect of its therapeutic dose during the time. So initial high dose or the maximum dose used to prime the bloodstream with a sufficient level of drug, and this drug often followed by a series of lower maintenance doses. While the maintenance doses, that is those required to keep the drug blood level at a steady state or plateau. We have many routes of drug administration, and we have what we call the major routes of drug administration, which include the enteral or the oral drug, that the drug that administered per oral, and we have the parenteral, that drug administered either intravenous or intramuscular, subcutaneous or intradermal. And also we have the topical dog administration that uses our skin. So also we have additional method for special drugs or for special administration, like intralesional, that means directly in the lesion, or intrathecal in the cerebrospinal fluid, or intraspinal, either hypodural or low epidural. And also we have what we call intracardiac, that means it administered in the heart, and also when we administer the drug inside the lung or pleural, we call it intrapleural. And also when we give a catheter via arteries, we call it intraarterial. And if we give it directly in the joint, we call it intraarticular. So this is the additional site of administration of drug. Now, what are the factors that determine the choice of a drug administration? How we use the right route? And this is include the physical and chemical properties of the drug, that means the drug characteristics, and the dose form, if it is liquid or tablet or solid or something like that. And if the site of desired action, systemic or local, if we want to give it systemic or local, also this is gives idea how to choose the right site of administration of this drug. Also, the rate and extent of absorption is very important to choose the right or the correct site or route of administration. Also, effect of digestive juice and first pass metabolism. This is, we know that is affect the drug effect or to reach the range of plasma level of the drug. And also we have how the drug rapidly the response to reach the desired effect, that means the onset of action, especially in emergency case. Also, accuracy of dosage required if it is intravenous or inhalation, and finally the patient's age and condition is very important to help us how to choose the correct route of drug administration. If you have a conscious or vomiting or something like. So, enteral route of drug administration. In this site of administration, we have some advantage and disadvantage. The advantage were that this drug, which given enteral, are easy and convenient, also non-invasive and often painless, as well as it have potentially reversible and mostly inexpensive. And the ideal of this medication, we can from these factors determine the advantage of the internal route or the drug that use orally. And the disadvantage of this site or this route of administration are first, this drug availability of absorption, have availability in absorption, also inactivation of some drug by gastric juice, because this drug will be given orally and it's possible to nausea or vomiting, and also not suitable for emergency special and conscious patient. So the oral administration preparation, that means the pharmaceutical preparation of oral drug, some of it are liquid, like syrups, elixirs and emulsion, suspension or mixture, or oral spray. This is type of preparation of drug that will be given orally. Also some of it solid, like tablet, capsule, lozenges, powder, and also enteric coated or controlled release tablet. And we speak it here that this drug are covered with a material designed to dissolve in alkaline environment of the intestine, because when we give it orally, drug reach the intestinal tract. And this is the same what we speak about, enteric coated or control release tablet. Is very important that this tablet will remain more time in the blood plasma, because it is absorbed or dissolved very slowly. Now, the sublingual or buccal route, this is drug given under the tongue, and the buccal route, that means the drug put or held between the gum and the cheek. This is usually used for heart disease. The advantage of giving drug under the tongue, its action can be produced in minutes and also not subjected to destructive digestive enzyme or undergo hepatic first pass metabolism, because it absorbed directly from the tongue tissue. And also this drug, like nitroglycerin for angina. This is very important or it must be given sublingual. The disadvantage of this drug is irritation of oral mucosa and excessive salivation from a tablet swallowing. This is maybe lead to swallow the tablet if we have irritation and saliva or salivation, mean excessive secretion of saliva. When we use the parenteral routes, that we mean if we give it or intravenously or intramuscular or subcutaneous, and this route of administration we must give it by injection, and this drug reach directly to the tissue and bloodstream. So if we give it intramuscular drug injected deeply in the large skeletal muscle, and if we give it intravenous, that means it give it directly to the bloodstream, and we use the superficial veins for administered drug. And if we give it subcutaneously, this is drug injected into the adipose tissue. And if we give it intradermal, this is drug injected into the dermis, especially in the tuberculin test of tuberculosis. The advantage of parenteral routes provide rapid onset of action, as well as used for drug with poor absorption from intestine, as well as intramuscular permits use of depot preparations, as well as IV injection permits use of large drug volume. Subcutaneous route commonly used for only a few drugs because many drugs are irritation to skin tissue. So maybe it causes pain, necrosis, abscess formation. The use of intradermal route absorption will be slow and allow for good result when testing for allergic or administered local anesthesia. Also, this drug can be used for unstable of serious ill patient. I mean, if the patient was unconscious, yes, and cooperative or have vomiting. Also, this drug not cause gastric irritation and vomition because it don't reach the site, I mean the digestive system organs. And also there is no chance for interference by food or digestive juice. That means the drug will be not affected by the gastric juice. Also, it not gone to the it don't go to the liver, and it bypass the first pass effect. And also it have advantage and also it have disadvantage. The disadvantage, this preparation must be sterilized because it is given directly to the blood or to the tissue. The technique is invasive, sometimes painful, and inconvenient route. And also it need assistance for another person through, so it cannot be injected by the patient itself. And also in subcutaneous route absorption is slower than intramuscular because tissue is less vascular in subcutaneous tissue, and only small volume can be injected subcutaneous up to 1 ml, while intravenous we can give more, as well as in intramuscular we can give more dose of this drug. Also potential for injury. There is chance of local tissue injury risk of damage to blood vessel or nerve if need is not positioned correctly. So we must be careful to use the suitable site of injection of the drug when we drug it parenteral. And in general, parenteral route is more risky than oral route with many adverse effects and complications, especially when we use intravenous route. So if we use the topical drug, that we mean administered drug on the skin, or dermatomucosal route applied locally to skin or the lining membrane. So this type of route administration more convenient as well as is encouraging to the patient. And in the form of lotion or ointment, cream, powder, pens, drop, spray, suppositories or pizzers, as well. This is include transmitter patch. All these are drug can use topically or via skin. So and also it can produce local and systemic effect even if we give it over the skin. And this drug should not be applied to abraded or denuded skin unless directed to do so. I mean, some if we have some injuries or some drug will not be given topically. If we use the transdermal delivery system, that means use of drug as a skin patch, drug are readily absorbed from the skin, and the bypass digestive enzyme because it does not reach these organs, and also it bypass the liver where it may be inactivated by the first passive fact in the liver. So this is the advantage for transdermal, and it will be slowly observed and less frequently used because we see it is a special condition if we want to use it in allergy test or especially in tuberculin or malign test. And this is maybe cause fewer adverse reaction and reduce the possibility of toxicity. This is very safety side. So we have other route by inhalation, and this is effective and convenient for patient with respiratory complaints such as asthma or chronic obstructive pulmonary disease. Like bronchodilators such as albuterol inhaler and corticosteroids such as fluticasone inhaler. This is, as I say, this is uses if we have disease in the respiratory system. This route also can be used for systemic effect. Can we use it in general anesthesia? And thank you very much for your listening.